Hello, everyone. Welcome to Music Therapy Secrets. My name is Tiana. I am a music therapy intern.
And my name is Judy, and I'm also a music therapy intern.
Today, we're going to talk about what music therapy is and defining it. It is the use of music interventions for non musical goals. For example, we use music to improve socialization, communication, cognition, and motor skills.
So you might be wondering, who do we work with? Everyone enjoys music, from babies in the womb to people in end of life. And we enjoy music in different cultural settings based on who we are and what our backgrounds are. And the communities that we serve include students in special education, the elderly in dementia, Alzheimer's, people in the military, patients in the hospital, people in mental health care units, people in correction and forensic settings, and also in hospice settings. So Tiana, tell us more about who are you working with and where are you right now?
Yeah, Judy. So I'm living in Hamilton, Ontario, Canada right now, and I'm working at Juravinski Cancer Center as well as Sensity in Paris, Ontario. It's the Deaf, Blind, and Sensory Support Network of Canada. What about you?
That's wonderful to hear, Tiana. And I'm working at UC Davis Children's Hospital in Sacramento, California. And I work with premature infants to 17-year-olds. I use music to help them cope better in the hospital. For example, we do songwriting, we do music making together. So you might be wondering, what's the difference between a music performer and a music therapist? So for a music therapist, we have a bachelor's or a master's degree in music therapy. And after our coursework in school, we move on to internship where we have to do 1,200 clinical hours, which is usually about 6 months. And after that, we have to take a board certification exam. Yeah, music in general is just so powerful and it's so amazing. That's why we have music teachers as well to teach people who want to learn how to use music. And for music educators, they have goals that are more specific towards, for example, learning the C major scale, learning the different rhythms, the different musical rhythms, and even just basic music theory. But for music therapists, our goals are not musical goals, but non-musical goals. So Tiana, I know you're also a musician and a performer. What's the difference when you perform music and when you're doing music therapy as a music therapist?
Well, I know a lot of music therapists use music performance as a way of giving themselves some self-care. Like it's our own way of expressing ourselves when we perform. I think, yeah, the main difference between being a musician as a performer and being a musician as a music therapist is that one of them is directed for you and your own personal mental health, and the other one is looking after your client and making sure that their goals are met and that they're feeling supported.
Well, Tiana, thank you for sharing with us your experience as a performer and a music therapist. And thank you all for joining us today. And tune in next week with Music Therapy Secrets for a video about how we use music to open a session. Take care, stay safe, and bye.
See everyone.